Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
The Chief Inspector of Hospitals in England has given a stark warning about the state of the NHS, saying it's standing on a burning platform, with 4 out of 5 trusts needing to improve patient safety. Professor Sir Mike Richards says the traditional model of caring for patients is no longer capable of delivering the needs of today's population. Our health editor, Hugh Pym, has the story.
I'm just going to bring your baby across and let you know about the checks we're going to do on him today.
A new birth today and a new beginning for this hospital in Cambridge. Maternity and other services were rated inadequate by the regulator, the Care Quality Commission, in 2015. The trust, which includes Addenbrooke's, was put into special measures. But now it's tackled the problems and is rated good.
It was a very big shock for our patients.
The boss who helped steer the hospital from the low point of special measures back to where it should be told me how they went about it.
The wider leadership team invested a huge amount of their time, in some cases well over 2 days a week, in going out into frontline clinical areas and talking to staff and listening to them and listening to patients about what needed to improve in the organisation.
The Care Quality Commission makes clear that while there are successful turnarounds like at this hospital, there are others where there's cause for concern and where care is still falling short. The CQC report said across major hospital trusts in England, 68% were rated as inadequate or needing improvement. 81% were said to need to improve safety, but 93% were praised for the caring attitude of staff. But those ratings were done before this winter's extreme pressures in hospitals, and the CQC says the whole system needs a complete overhaul.
Of course I have concerns about what's been happening, and I think we need to take a long look at that to see what more can be done in terms of improving the acute care model from emergency admission through the hospital through to discharge. So we need to look across the country at all of those things, but some hospitals are managing it better than others.
The system as a whole is under strain, but for some hospitals the mood is more relaxed. Those who, having had a bad inspection, have turned things around and got high marks for patient care. Hugh Pym, BBC News.
For the second time in 2 months, a coroner has warned the NHS that bed shortages have been a factor in otherwise preventable patient deaths. Teresa Dennett suffered a stroke and needed urgent brain surgery, but the nearest specialist unit was full, and another said it couldn't help.
We used to meet up most Saturdays.
Teresa Dennett spent every moment she could with her 2 grown-up children, but it was her young grandson she lived for. Fighting for survival in hospital after a sudden stroke, he was the only thing on her mind, as her daughter faced the heartbreaking task of asking whether she could face emergency brain surgery.
I asked her the question of, Mum, I need to know, do you want me to save your life to have surgery? She said yes, and she said Leo, which is a grandson. And that's when Dr. Livingston tried everything to get her into the hospital.
That night last February, the nearest intensive care unit at Nottingham University Hospitals was full, with another extra patient in the theatre recovery area. Marianne is still haunted by the sight of her mother's doctor trying to persuade Sheffield teaching hospitals to take her, only to be told it was Nottingham's responsibility.
I could see how much he was trying, and he knew that this is what my mum wanted. For him to come to us to take us into a room at 3 o'clock to say, unfortunately, my mum had deteriorated that much. I couldn't stay in there. I went to see my mum to tell her that I couldn't save her life.
Their mum was just 58. The coroner concluded Teresa probably would have survived, albeit with disabilities, if the operation had taken place. It's the second time in as many months a coroner's warned NHS England over bed availability to prevent further deaths. The response has been this letter from Medical Director Bruce Keogh, warning neurosurgical units The lack of critical care beds must not be a reason for refusing admission for patients requiring urgent surgery, but adding this should not exclude cooperation between neighbouring units, something both hospitals have now apologised for.
If you can't discharge a patient from the ward into social care, then you may not be able to discharge a patient from high dependency or ITU back onto the ward. So you do find situations where we can't move patients out of ITU or HTU because there's no ward beds.
And not being able to come up with a bed in time ultimately cost Teresa Dennett any chance of life. Rachel Younger, ITV News.
I've been getting